LDCs are low-income countries confronting severe structural impediments to sustainable development, and also their vulnerability to economic and environmental shocks. That's the kind of I think one particular characteristic is very important for us in the current pandemic context. And more importantly, they have low levels of human assets. That I will explain a little bit more why that really matters. And there are 47 countries in that list, but like in any categorization, just bear in mind that even in that group of countries, there are so many differences, when you think about it. And also, some of those countries are affected by armed conflict, but there are some countries like, say, Libya or Syria in the contemporary context. They are not in this list as LDCs. So it's also important to include our focus, not only LDCs, but those conflict zones. So let me start with the first question, why they are particularly vulnerable to COVID-19 pandemic. And I think the best answer for that is just look at the developed world and what's happening in countries like Italy, Spain, UK, US. And just seeing those countries, how much struggle they have had in the pandemic response really shows this the kind of the scale of the problem we are facing in the LDCs and conflict zones. We don't really know the real scale of the problem in LDCs and conflict zones at the moment. So when you look at for example, Africa as a particular context, the confirmed cases in Africa as of today, I think it's just over 72,000. And number of deaths are 4,400. That's for the entire African continent. So I'm sure that one thing that really strikes you is that how low these numbers are. So, you could assume that, well, perhaps, the pandemic is not in Africa yet, or perhaps we really don't know what's happening in those countries to a large extent, simply because the low number of tests that have been carried out in the continent. The overall numbers we have for Africa, where most of the LDCs are, really don't represent the full scale of the problem we face. So we need to bear that in mind, when we think about how we are responding to the pandemic. And I think within that, though, we really need to bear in mind that most of those countries, obviously in the pandemic response, healthcare systems, the kind of frontline kind of service. So it is really either informal or insufficient or non-existent in some of those countries or conflict zones. So that is one of the main vulnerabilities. The hospitals with intensive care units or number of doctors and nurses, physical infrastructure that you would need in that response. They don't have such facilities in many of those countries. And on top of that, LDCs and conflict zones obviously suffer from weak states in terms of governance, infrastructure, and welfare. And all of those are really important, as we know, in the pandemic response. So it's about testing, it's about tracing, it's about isolating those cases, treating them, the entire process of pandemic response. When you think about that, you could understand the problems that we are facing in LDCs. And finally, the issue of poverty is, I think, really significant, because in the absence of a vaccination or the proper effective treatment, medical treatment, the main tool we have at the moment is obviously social isolation. But expecting poor people to go for social isolation is really pipe dream, because they really need to make that daily living in order to survive. You cannot really expect them to stay home. The whole idea of lockdown for many people in those countries is a luxury. Yes, I know in the West we complain about it, but in those countries it's a luxury. So in that way, I think that's a particular vulnerability that we are facing in LDCs and conflict zones. When we come to conflict zones, environments affected by armed conflict, just magnify those problems, because there are a number of other characteristics that we need to bear in mind. So obviously the security challenges. in countries like Syria, Yemen, or Libya, when people are under the physical threat of armed conflict, how would you be able to run a proper pandemic response? It's a big question. And within that, obviously, accessing the war-affected population is a huge issue. Internally displaced people and refugees. So what's happening in some parts of Syria and Libya is really anybody's guess at the moment. Syrian refugees, for example, in the camps living in Greek islands in the Aegean. We have received a number of reports about the absence of proper, health response to this challenge. So those populations are particularly vulnerable. And the vulnerability is increased to another level simply because, armed conflict destroys infrastructure and services, so makes the situation that's faced by LDCs even worse. And on top of that, if you want me to depress you even further, then you got to just bear in mind the sort of challenge of divided communities. In the current pandemic response in our communities, one of the things that we realized that community solidarity really, really matters. We help each other. We are the first responders in our communities. But when you have divided communities, obviously, the chances for this is really much less. So that's a kind of a particular vulnerability with those populations in the COVID-19 pandemic response. What's going to happen once the pandemic in those countries and conflict zones? Probably hundreds and thousands of people will die, and they won't be even, recorded. They will just, pass away. And the fear I had was that, we cannot ignore this. This is not the kind of world I want to live in. But then we start to have a number of key initiatives, starting by the UN, WHO, like the COVID-19 Solidarity Response Fund. And similarly, the World Bank said, okay, we are going to give $12 billion as a fast-track package to developing countries. You must have seen a number of campaigns run by the international NGOs at the moment for this thing, for the challenge. Finances is only part of the response that needed. Actuality, when we think about the pandemic response in our own countries, there are so many other dimensions to bear in mind. So finance is part of it, but LDCs and conflict zones really need our full cooperation in all aspects of the pandemic response. So with that, with the United Nations Secretary General Guterres initiative, the kind of global ceasefire, I thought that was just a fantastic idea. Using this pandemic as an opportunity, responding to that challenge, and this would have been so important, in accessing conflict-affected populations, improving security environment in those countries so that we can actually provide assistance in different ways, so on and so forth. I mean, that was really critical. But that has been rejected by the Security Council and missed a big major opportunity. So it's really, really unfortunate that, that hasn't been realized. My next question then is, why a poor response? One is that, while the problem is global, the pandemic, all countries today, I think Lesotho was the last country to confirm a case in Africa. So, you all now have the confirmation of a case. So it's a real, true sense of global problem. But we've been trying to deal with, through the means of nation-state response. So shutting down borders, trying to contain the problem, and not much really international cooperation. Powerful countries like US, UK, and a number of countries in the European Union, they've been really struggling. So that kind of paralysis probably had an impact in the way that we had a poor response in LDCs. I mean, so much so that even some allies in the EU, like, they didn't show much solidarity for each other. Spain and Italy have been complaining about this bitterly. And so when the circumstances are such that, in the European Union, what chance is there for LDCs to expect, solidarity from those countries? Overall, it seems that we were quite unprepared globally for this. I'm hoping that this whole idea of pandemics and the health disasters will be much more in the humanities DNA, and I do hope that there will be better preparedness for that. But one of the other issues that for the poor response is the lack of intentional leadership, and that is when you look at number of powerful countries and their leaders, it's not really one of those eras that we can describe as the intentionalization kind of agenda. Very much polarization and very much populist politics. So really kind of makes this intentional partnership much more difficult. And unfortunately, the pandemic happened in such a context. Unfortunately, populations in LDCs, in conflict zones, in the minds and hearts of lots of people, and especially politicians, are quite dispensable. I don't think we really care much about those populations. They are not really priority. So, if you ask me why that has been a poor response, I would say that has also been quite a significant reason. So really just sort of move to the last part of my presentation and the last question, why helping the LDCs and war-affected communities is particularly important for the global fight against the pandemic. I think this is a moral responsibility, for the humanity to help each other in solidarity. So, this may be global pandemic, we might have problems in every country, etc. But, if you ask me to describe humanity, I would say that that innate quality of helping each other is the best characteristic of the humanity. The second one is that if we don't help those countries today, then what we are going to see that probably security conditions will be worsening in some of them, in the war-affected environments. And without proper assistance to LDCs, probably we are going to have more serious economic and developmental problems in the future. Let's deal with this problem before it becomes a total catastrophe, right? So in that way, I think there's direct benefit of helping those countries today in our global world. And in that way, I do believe that helping those countries will make the whole recovery process globally much quicker. So in a way, sooner or later, the travel bans will be lifted. People will start to move around the world. It's going to be very difficult to control. So, you can control your pandemic in the US, UK, or Italy, but what's happening in Africa will have an impact on you in LDCs, or some of those refugees living in our countries, So you've got to deal with those issues concurrently. It's not something that should be postponed to future. Within this, I don't want to pathologize LDCs. I don't want to kind of say that they passively sit back and do nothing about this. In fact, African countries are also trying to deal with this issue. And at the community level, we know that there's so much happening. So we really need to recognize the kind of the human reaction to this. We also need to recognize that, some unexpected countries or countries that, done lots of things, but we ignored to a large extent in this. So China tried to help a number of countries. Cuba sent its doctors and nurses to a number of European and African countries. So I thought that that's a kind of something that I would share with future generations. And this is important, the kind of this good human stories, because, yes, it's important to learn lessons from our mistakes, but at the same time, when it comes to policy making, we need to recognize the significance of that community engagement. I would say, the issue of exit strategies will be really important. So once we start to provide that assistance, I don't think our exit should be like cut and run. That would be the worst thing to do. We need to sort of think about how to transition some of this assistance into other types of programs so that we can strengthen the public health structures, for example, in those countries. Because right now we know that without a vaccination and treatment, there might be other waves of the pandemic over the next 6 months to a year. So as a matter of global preparedness, I think that would be great. There are a number of, I think, lessons we learned from the pandemic response, and the first one of which is the significance of international cooperation. In the global world, dealing with pandemics, as a nation-state response really is not working. We've got to change this attitude. And if there's a global evaluation of the pandemic response, I'm sure that is going to be one of the lessons learned on the top of that list. The second one is the importance of good and bad leadership. So certain countries, the way they achieved amazing results, like New Zealand, in a short span of time in controlling the pandemic, and others, outright ignoring and even kind of working against the advice from the medics and the public health experts. Brazil is a quite an interesting example with that. So, good and bad leadership really sort of signifies, yes, the trigger, the pandemic is there, but the disaster is really created by us. The way we respond to pandemic, the scale of it, is not inevitable. It can be controlled, it can be dealt with by, mobilizing some of these resources that needed, but leadership is really important. The third issue, I guess, is that the significance of public health. So living here in the US, I live this every day. So knowing that some people don't even want to call an ambulance because they are so afraid of the cost of that. I mean, obviously some of this has changed in due course, but coming from the UK previously, this was never in my mind. So if you are sick, then you sort of go to your national health system. There's the provision, the security. But in this country, lots of people don't have that. And again, in this country, which is the most powerful country in the world today, certain groups like the African Americans, for example, are disproportionately affected by the pandemic. So I think this really underlines the importance of the public health and the measures and provisions with that. I am not that confident that we'll be able to draw those lessons and move that better world that easily, because soon once the pandemic is over, this may become a little bit more habitual, and then the humanity would start to kind of talk about, oh well, we experienced this because of certain groups. I mean, that scapegoating has already taken place, and there's quite a bit scapegoating of China for this. What I'm saying is that there's a window of opportunity for change, and in the disaster management field, we know that up to 6 months to a year after that particular event, you have the opportunity to reform, to change progressively. Let's take this opportunity, and probably responding to LDCs and conflict zones could be one of the trigger of that process. In the recent times, over the last 10-15 years, like MERS and the Ebola crisis, etc., they affected certain regions or countries. So, and especially with they were not really, they didn't really affect the developed world. So, the mobilization of resources and capacities for the needs of these countries were easier. It was an option. So I think that's the kind of main difference between with the COVID-19 and the previous recent ones. And it's the global scale and the way that this one obviously affected then the developed world too. And so, in a smaller scale like Ebola and others, WHO, for example, seemed to be much more effective with sort of setting up policies and coordinating activities globally. But when it's happened at the much wider scale, it seems that we kind of fall apart, right? Fallen apart, and that is one of the kind of like one of the reasons I was talking about that global unpreparedness. So it seems to me that we were perhaps more prepared for kind of like the regional kind of more country-based health disasters, but not a global one. You know, this now we need to write our scenarios differently. So what happens if a particular disaster affects all countries, right? So in such circumstances, what we need to do, and I think that's probably the main lesson that we should learn from, you know, in comparison to previous pandemics. Well, I think that the gender impact has been an issue not only for LDCs but globally, because we know that there has been an increase with the domestic violence, for example, with the lockdowns, and there have been a number of interesting reports on this. So clearly, there is a gender, aspect with this. But with the LDCs and with the realities of economic structures and the role of women in some of those countries, and access to, you know, the health facilities, etc., you know, we have already had some significant problems around gender and health. And on top of that, when you have the impact of the pandemic, I think the circumstances faced by women have worsened because of that. So there is a clear gender dimension that we need to recognize in that response. Absolutely. In the pandemic response, it doesn't seem to me that the UN and the Secretary General has had that sort of pivotal coordinator role, right? He really didn't appear as the kind of the face of that global international response. And even WHO, as we know, has had some issues in that kind of global response. So in a way, there's an absence of that international leadership, right? So if you want to set an agenda, a global agenda, and it's especially if that agenda is about a sort of global ceasefire, right? You've got to go out there and put yourself in the minds and hearts of people, the media, the politicians, right? So, I mean, you are not going to be able to do this by just sort of releasing press statements. You know, you've got to work much harder and, you know, and gather a global alliance, you know, the kind of like you will say that sort of the elderly of the peace circles, you know, people who can support you in this initiative. You've got to bring some foundations on board to work with you. So this has, you know, this shouldn't have been just like, you know, the Secretary General's the proposition, but much more kind of like the global gathering. You know, ordinary people to push their politicians, you know, for that particular agenda. You got to get into their bandwidth. I don't think this message has really entered in the bandwidth of many people. Probably, you know, we should have mobilized our celebrities, our singers, you know, I'm kind of thinking about like early 1980s concerts for the Ethiopia famine crisis, like gathering momentum globally. For me, the absence of that sort of global mobilization has been one of the reasons that we haven't gone far. Having said that, also we have some really interesting political leaders in some of those powerful countries. You know, they are not prepared to listen to common sense. They are not prepared to listen to, you know, such propositions. And that is probably the unfortunate, you know, reality of this pandemic. It's been happening in a world where there is an absence of good international leadership. But because global phenomenon and this issue, you know, really creates this window of opportunity. You know, that kind of global ceasefire, you know, humanitarian ceasefire. Let's call that global humanitarian ceasefire to address health issues of those populations living in conflict-affected countries, right? Let's make this 3 months to start with, or 6 months. But, you know, and we have had a number of, you know, examples of this in the past, you know, and you know, in Aceh, for example, this was done, and which led to the ceasefire later on after the tsunami. So, you know, it's not impossible, but and it's wonderful. It's quite ambitious. It's a global, you know, ceasefire. but I think it really needs to mobilize the world more effectively. Still, in most of these countries, there is some level of democracy happening. So, those politicians still answerable to their constituencies. There are still elections. If you are able to enter in the bandwidth of people, this may matter. Mobilization really needs to be bottom up in that way. We really mobilize people, and so it may be quite difficult in the current pandemic environment, but at the same time, I think in the current environment, this is the opportunity created by disasters generally. People tend to be more giving and understanding, the sense of that solidarity is more out there. So we might use this as an opportunity, but it needs to be explained properly why it is important. A number of international NGOs have been on the forefront in this fight against the pandemic in LDCs, and they've been running their own campaigns to raise funding. So Doctors Without Borders is a prime example, but a number of other humanitarian agencies. And the reason for that, I think the individual and community engagement is really important. There has been a number of reports about conflict-affected countries, and in a way that the local peace builders and how they become kind of like the people on the forefront, fighting against the pandemic. Because peace builders with the kind of certain training and capacities and experience, they have the structures, they kind of mobilized, their peace building activities into more, pandemic response type activities. And so that really shows the significance of community mobilization. If there are certain mechanisms and structures already exist as kind of core of those activities, it's easier to mobilize these people. And individually, I read this young man from Cameroon who got together with his friends in order to produce disinfectants for their community, right? So people do lots of things, within their resources and capacities to respond to the pandemic. And hence, that was one of my points, that let's not pathologize these environments like, being passive recipient and complete helplessness. That's not the case. But the scale of the problem is such that will require much wider and bigger, resources. So in that way, I think, when you think about any country, developed world or underdeveloped, developing LDCs, conflict zones, the best and the most important asset we have is really human resources, our communities, our individuals, in these communities. Because if you are able to mobilize them effectively, really in many ways you can do so much more. Like prime example, tracing. So you identify somebody with the COVID-19, and after that you started kind of tracing, in order to isolate others. Probably that's the most effective response strategy we have right now. If your community is functioning properly, it's much easier to do this. But in conflict-affected countries, for example, it's more difficult. With the suspicion of divided communities, tracing becomes almost impossible, even if you want to do that, right? So much happening in these communities in response to a pandemic response, but large part of them go unnoticed. And whatever we see in the media is a very small segment of this, and we see them as the kind of good, heartwarming human stories, right? That's wonderful. But I would argue that we really need to be more deliberate about this and really collect those good, heartwarming human stories and really pass them to future generations, but particularly policymakers when it comes to disaster management, future preparedness. Because, we really need to understand that, this is not all about lessons learned from the bad experiences. We really need to understand and learn lessons from our good actions. If solidarity is one thing that you got to ensure in such environments, the other thing that really matters is good communications. You got to communicate with people. And so when in the current pandemic, for example, certain countries have done this so well, and they tend to be really the good countries, in terms of their performance in the pandemic response. Their leaders appeared, in front of public, and always their point was to explain what's happening. They were accountable and they were trustworthy. So when they say something, their public believed them, right? And I think that's really matters. So, when it comes to, for example, sending medical supplies to other countries, if you trust your political leadership, and if they say, look, we have enough in this country, so it doesn't matter if we send some to country A or B, right? If you have that kind of trust with your public, I don't think that's going to be a problem. I think the problem is that when you are not able to communicate or build that kind of relations of trust with your constituencies, with the public. And I think that's really, one of the key characteristics of the difference between good leadership and bad leadership. That sort of reminds me the 1980s famine in Ethiopia. When I teach that particular case study to my students a few years ago, I always underline the significance that it wasn't for the absence of food. It was about the distribution of food to those different people, right? So right now, all the kind of the problems we are facing with the medical supplies, etc., globally, it's not actually the absence of that globally. It's just the distribution. And why? Because we are not cooperating, we are not communicating with each other. So, in the face of a disaster, if we had a better preparedness, better internationalization agenda, then I think, the movement of supplies could have been more effective, right? So, for example, there is no excuse that a structure like European Union has failed in this, right? So other countries, that maybe you can quote lots of reasons why this is not happening. But in the EU now, it's quite now close to political union. There are lots of structures, etc. But not being able to deal with this in a more coordinated manner, so that when the needs are really acute in Spain and Italy, not being able to help those countries, those leaders really need to sort of think about such failures and I don't think the issue is really, public and, ordinary people are mean. They don't want to help each other. But I think it's a human reaction, okay, I care about my family, my kids, etc. And if we don't have enough supplies, what's going to happen to us? I think that is the kind of the fear. And politicians have the responsibility to get rid of that. And that can only happen with good communication and building trust in disaster response. So I would say, I would leave that to the door of the politicians and political leadership, really, to a large extent. It's a choice that we are making right now, honestly. So, what kind of post-pandemic world we want to create? The option one is probably to accept the reality, and that's going to be much worse. The kind of new world will be worse than what it was. We can aim for addressing some of these issues, but just going back to normality like as it was, but that's not really advisable because of the circumstances we are facing right now. Or the third option, really just, doing a proper soul searching here. It's almost like what we need is a Truth and Reconciliation Commission type activity. We need to recover the truth about our own greed, our own ignorance, our own ineffectiveness, in our own the way the humanity lived, consumed, and related to each other. Such soul searching is really needed, and without that, the best option really could be just going back to some sort of old normality, and that's unfortunate. This is really one of the things that academia, civil society, and the media could do, really just to sort of create an effective debate about these issues, right? So if you think that we are facing problems today because we have a health crisis, this is just nothing. For many societies, in comparison to what they might be facing in the future, this could be just a small headache, right? And so, you've got to realize that, perhaps it's a warning. let's take this as an early warning about who we are as a humanity and the need for change, right? At least that we have some awareness now. The pandemic showed us, the things were not quite right. So I'm just hoping that we are going to just take that opportunity and do, better as a humanity.